What do you think causes carpal tunnel syndrome? Hi there! Welcome back to the Elite Carpal Tunnel channel. I'm Dr. Travis Peterson, a board-certified orthopedic surgeon with subspecialty certification in hand surgery. Today we are diving into what we know about the causes of carpal tunnel syndrome and the factors contributing to it. Carpal tunnel syndrome is a medical condition that occurs when the median nerve in the wrist is compressed, leading to symptoms such as numbness, tingling, pain, and weakness in the hand and fingers. So what causes carpal tunnel syndrome? Well, it's actually not an easy question to answer. Many doctors and researchers have been on the hunt for answers, and while we've uncovered some insights, there are still mysteries. For instance, there's a common belief that excessive computer use and typing cause carpal tunnel syndrome, but this hasn't been definitively proven. It's a notion that's gained more popularity than scientific support. A prominent hand surgery and research team said the following about that idea: the pervasiveness of this viewpoint in the general population is disproportionate to its scientific support. As this statement suggests, sometimes beliefs can outpace scientific evidence. In fact, according to the Journal of Hand Surgery, the primary causes of carpal tunnel syndrome appear to be structural, genetic, and biological factors, with environmental and occupational influences like typing playing a lesser role. We should approach speculative theories with caution until good data is available. While there's a long list of possible causes, the common causes of carpal tunnel syndrome are more limited. A few of these include trauma, such as fractures, can increase the pressure on the median nerve. Pregnancy. This may be due to fluid retention and/or hormonal shifts associated with pregnancy. Structural, genetic factors. Some structural body differences may contribute to the development of carpal tunnel syndrome. But here's the catch. Surprisingly, despite these common causes, most carpal tunnel syndrome cases are actually considered idiopathic, which means we don't know the exact cause. But don't get discouraged. There's good news to share after I talk a bit about associations. Carpal tunnel syndrome can be associated with other issues. Associations are when two things often occur together, but one doesn't necessarily cause the other. Similarly, certain conditions may increase your chances of getting carpal tunnel syndrome without directly causing it. Examples include diabetes, hypothyroidism, and obesity. Dealing with carpal tunnel syndrome can be frustrating, especially when the exact cause is not known. As I've mentioned, fortunately, there's good news. First, research to increase our understanding of carpal tunnel syndrome is ongoing. Second, and perhaps most importantly to you, even though we may not know the exact cause of carpal tunnel syndrome, we can definitely still identify it and successfully treat it. One common misconception is that time alone will heal carpal tunnel syndrome. While the adage, "time heals all wounds," may apply to some situations, it's often not the case with carpal tunnel syndrome. Symptom intensity may go up and down at times. When symptoms are less, we may think our carpal tunnel syndrome is going away. While possible, symptoms usually worsen over time in spite of temporary easing. Ignoring it can lead to nerve damage and permanent symptoms. So if you're experiencing symptoms, don't delay. Not wanting to address this is understandable. After all, who really wants to go to the doctor? Listen to what some of my patients have said about waiting and the relief they got when they finally decided to get treatment.
I can finally sleep without the throbbing pain I lived with off and on for 30 years.
I knew I had carpal tunnel syndrome for several years, but didn't rush to address it until recently. When the pain and numbness started affecting more and more of my daily activities and work, I was desperate to find a solution. It's been just over 2 weeks and the numbness and pain I was experiencing is gone.
I knew I needed carpal tunnel surgery but put it off for years. One day, after a full day of working in my yard, the numbness and tingling in my hands kept waking me up. This continued for many nights and I knew I needed to take care of it immediately. After surgery, my pain, numbness, and tingling were completely relieved overnight. I could sleep again without my hands waking me up. My only regret was not finding elite carpal tunnel sooner.
I suffered for more than 2 years with pain and severe numbness. I tried all the injections, braces and therapy and nothing worked. I wasn't sleeping, I couldn't use my thumb, I was so frustrated. After my surgery, the numbness was gone immediately.
Regardless of the cause or how long you've been having symptoms, seeking evaluation from a qualified professional is the best approach. A correct diagnosis leads to an effective treatment plan. Don't wait. Take the steps now to get relief from your symptoms. Thanks for watching. If you found this video helpful, please feel free to give it a thumbs up and share it with others who might benefit. Click the links to watch our other videos on the symptoms and anatomy behind carpal tunnel syndrome. We'll see you in the next video. Until then, take care of your hands and stay well.